Dear friends and colleagues, good morning, welcome, and thank you for attending today's Health Equalities Conference. Equalities, that is if you work for BHFT, but for us in the community, we would rather think of it as Health Inequalities Conference, as there are still structural issues regarding fair access to health care affecting individuals and communities that still need to be resolved. Health inequality because of the deeply entrenched socioeconomic imbalance that affects majority of minority communities, and that was brutally exposed by the COVID crisis, which saw people from Black, Asian, and other ethnic minorities being disproportionately affected by the disease. Key factors for this include poor and overcrowded housing conditions, low or underpaid jobs, taking or serving in high-risk frontline jobs. However, not all of the blame lies with the healthcare system, but an unhealthy mind and body eventually has to call on healthcare provision when things get bad. We will be hearing from Health Watch Reading about their findings on the healthcare needs of asylum seekers corralled at the George Hotel in Reading. Asylum seekers and refugees now firmly represent an underclass when it comes to health outcomes. We will also be hearing a progress report from Berkshire West CCG on their new health and well-being strategy that is being developed. This year we have titled the conference Communities Filling in the Gaps for Good Reason. Communities are becoming more aware of not only their rights, the responsibility that they have to carry for their respective communities and the Reading Society, but also the need for representing community voices where and when it is needed. We will hear from community representatives and especially young voices on the work they've been doing in the community to inform and enlighten our communities. Young people are at a loss to know what next in terms of jobs, owning their homes, future prospects. This is incubating a mental health crisis for the future. Okay, enough of the gloom and doom. Last April at this very conference, the communities challenged the health and social care authorities to trust and invest in the community. We also challenged them to engage with communities more in terms of finding out their needs. I also made a personal wish that in the light of what had happened in the early days of the COVID pandemic, that we would meet, that when we meet this year, that we would be approaching health equality. We are not there yet, but evidence is beginning to show that they are listening and they have taken some action. Senior social and healthcare officers have engaged with communities and had meaningful discussions. With the help of RBC Adult Social Care and RVA, that is Reading Volunteer Action, and Berkshire West CCG community grants, ECA and community support partners have just delivered and completed a mental health first aid and suicide awareness first aid courses for 20 community representatives and leaders. We are thinking of running that program again as a means of empowering our communities to deal with issues within their communities. It's not always that we should be looking up to services to meet our needs. If we're aware and we're astute enough, we could deal with some of the issues and only take those that we can't to the authorities. ECA and our community partners, including Utulivu Women's Group, have received encouraging signs of support from NHS charity Berkshire, Oxfordshire, Berkshire. I would stop and in the hope that we, because we're planning to start what is a community well-being hub, that would be encompassing providing, a safe space for people to gather and receive services. and we would be approaching some of our healthcare providers, advice agencies, to actually come out into the community and meet people and address their needs in their locality. I would really stop so that you can hear from our speakers and how the community support network have come together to fill in the gaps. The bad news, though, if I can put it that way, is that I'm not here at the beginning of the conference, but I hope to join at a later time. I have to report that one of the founding members of Reading Council for Racial Equality and eventually ACRE, who had passed away, the wife also passed away a couple of weeks ago, and she's being buried today. And I've been asked as the lead officer for ACRE to be part of the funeral arrangement, or the funeral. As soon as I finish with that, I will come and join in. I hope we have a very good discussion, and I hope that our speakers would be able to inform and educate and encourage you to say, look, we're out here, we're quite willing, you know, public services, please engage with us, please support us so that we can deliver for our communities. Thank you and goodbye.